Good afternoon, everyone. Thanks to the collective efforts of the people of Ontario, tomorrow our province will safely enter step 1 of our roadmap to reopen. After much sacrifice, Ontarians will be able to safely participate in many activities they enjoy: dinner on a patio, outdoor fitness classes, and shopping in person at their favorite store. This was in large part due to the willingness of individuals to roll up their sleeve to receive the vaccine. As we begin to gradually lift public health measures, the ongoing success of the province's vaccine rollout will ensure a strong level of protection against COVID-19 and variants. As of today, over 10.6 million doses of the vaccine have been administered. Over 73% of adults have received their first dose of the vaccine, and over 11% are fully immunized. We are making tremendous progress, but it does not stop there. To further stop the spread of COVID-19 and support Delta hotspots, we are further expanding booking eligibility for an accelerated second dose in select regions across the province. Beginning Monday, June 14th at 8 a.m., individuals who live in Halton, Peel, Porcupine, Toronto, Waterloo, Wellington, Duffer and Guelph, and York Public Health units, and who received their first dose on or before May 9th will be able to book a second dose appointment. Appointments can be booked through the provincial booking system, through public health units using their own booking systems, and participating pharmacies and primary care settings. We will continue to expand eligibility for accelerated second doses as additional vaccine allocations are confirmed by the federal government. As Ontario begins to reopen, I know many Ontarians are excited to enjoy the warm weather and see families and friends. This is an exciting time, and we know that there are brighter days ahead. Please continue to follow the public health measures that are in place to keep us safe and get vaccinated as soon as you're able. If we all do our part, we will be able to enjoy a safe two-dose summer. Thank you so much, and now I'd like to hand it over to the Solicitor General.
Thank you, Minister Elliott. While we know that the fight against COVID-19 isn't over just yet, Ontario continues to make tremendous progress on the vaccination front, and we can all be proud of the progress we have made together. In addition to the enhancements just mentioned by Minister Elliott, we are also making strides in helping speed up vaccinations by continuing to work with public health units and employers to get more people fully immunized. To further help stop the spread of COVID-19 and protect communities with the highest rates of Delta variant transmissions, mobile vaccination units that provided first doses will start operating second dose clinics beginning the week of June 20th in Peel, York, and Toronto. These mobile vaccine units will administer second doses to employees at small and medium-sized workplaces who cannot work from home, and to individuals aged 18 and over who received their first dose on or before April the 18th. Employer-led clinics that provided first doses in Peel region will also begin second dose clinics the week of June 20th. Increasing first and second dose coverage in Delta variant areas of concern will help to minimize the risk of its spread and ultimately protect communities province-wide. We will continue to expand eligibility for accelerated second doses as additional vaccine allegations are confirmed by the federal government. Thanks to this significant progress on the vaccination front and our collective efforts in following public health measures, we've been able to bring our province to a stage where it is now possible to cautiously begin lifting certain public health and workplace safety measures. As we cautiously move through our roadmap to reopen, with step 1 starting tomorrow at 12:01 a.m., it is critical that we continue to practice physical distancing, wear a face covering in indoor spaces, and whenever physically distancing is a challenge, and adhere to public health and workplace safety measures currently in place. Through our careful and concerted efforts, we can overcome the still significant risks that challenges and remain present in our communities. Stay safe And thank you.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Laura Stone with the Globe and Mail. Please go ahead.
Hi, Ministers. I wanted to first ask about AstraZeneca and your government's decision not to change the 12-week interval. I think a lot of people who got this vaccine are very disappointed by this, especially seeing other provinces shorten it. So can you explain why your government is choosing not to do this, and what do you tell the people who now are potentially regretting getting this vaccine?
Well, hi, Laura. First of all, the information that we have and the evidence that we have and the medical experts in Ontario suggests that the time limit between first and second doses for AstraZeneca is 12 weeks. That is the gold standard, and that's why we are relying on that and continuing to have that as the rule for dosages and second doses of AstraZeneca. We want to make sure that we can protect all of the people of the province of Ontario, and the evidence to date suggests that the 12-week period is the best interval in between the first and second doses.
Follow-up.
Thank you. And can you explain, with the new Delta strategy, you're not actually sending these public health units more supply, and officials this morning suggested that some public health units are not fully utilizing what they have. Can you expand on that? Can you name the public health units that are not using their supply, and what is the government going to do to ensure that this gets out the door?
Mm-hmm. Well, what I can tell you is that we are working virtually on a daily basis with all of the public health units across the province and asking them to use what they have in their freezers to make sure that we can get as many needles into arms as possible. And as they work through what they have remaining, then they will be receiving more supplies, because we are dealing with a Delta variant, which remains a variant of concern. But it is something that I know in the past has been an issue for the public health unit regions, because we didn't have a reliable and steady supply of vaccines. But that has changed now. We are receiving large quantities of the Pfizer vaccine in particular. And so we are asking the areas in those 7 units that are the Delta concern areas to use what they have in their freezers first, and then we will happily supply them with additional supplies so that they can continue to work on their first doses as well as their second doses.
Next question.
Your next question comes from John McGrath with TVO. Please go ahead.
Hi, Minister. Returning to AstraZeneca, I know that the evidence suggests that 12 weeks is the most effective interval, but plenty of doctors I've spoken to have said that 8 weeks would certainly be sufficient, given the context that we're in, where one dose still leaves people very vulnerable, especially to the Delta variant. This government allowed people to go to 10 weeks with informed consent. Why would you not allow people to opt for an 8-week timeline with informed consent if that's what they choose?
Well, this is an area that continues to be under study, but at the present time, we have been advised by our medical officers that we should remain at 12 weeks. As I said, that is the gold standard, but it is being studied, and there may be further information in the future. But as of today, that's what we're working with, and that's what our medical experts have advised us to do.
Follow-up.
In terms of the Moderna news from the federal government yesterday, are we looking at, based on the millions of doses that Ontario would accept, we should be at something like maybe 40 or 50% of people with second doses, if not by late June, then certainly by earlier mid-July. Is there any discussion of accelerating the passage through the various stages of reopening, given how quickly we're going to start moving through some of the benchmarks?
Well, it is very good news that we are going to be receiving a large quantity of the Moderna vaccines before the end of June. But we're just waiting right now to find out about the timing of receipt of those doses and quantities. We expect to receive 38% of the doses that are coming in, but it is something that we are looking at on a daily basis. Our Chief Medical Officer of Health has been helping us with Roadmap to Reopen. He has advised that as we move into stage 1, we still need 3 weeks before we continue to consider phase 2, assuming that we will have met all of the targets that we need to meet to get to phase 2. But things are doing very well so far. We have over 11% of our population that has been double vaccinated. We need to get to 20, and we're making sure that we continue to keep the quantities up by through our mass vaccination clinics, through pop-up clinics that are happening, through the pharmacies. We're adding more and more pharmacies, and through primary care. So that is something that we're looking at right now. We still have to meet those targets, and Dr. Williams is recommending that 3-week interval, but we're reviewing the situation on a daily basis.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Minister. Just to pick up on your last answer there, so it doesn't sound like you're ruling out moving through the 21-day waiting period. So what are the things that you would consider moving ahead? Would you consider moving ahead haircuts, for example?
Well, I know that's an issue that many people are concerned about, but it is something that is really up to our medical experts to advise. So once we move into stage 1, we need to see how that goes, what is the effect of that first opening on the health of the people of Ontario. And so I would suggest that it's too soon to say what we might be able to do with subsequent intervals, but we'll have to see what the effect is now and starting tomorrow with the health of people in Ontario, and then our medical officer of health and his advisors will then advise us accordingly.
Follow up.
Given and just following up on that, given your concerns about the Delta variant and moving up these shots, do you think it would be perhaps perilous to advance the stages of the reopening, given that we've seen lots of curveballs from COVID-19 before?
I would say that we need to move very cautiously and very carefully because while we are seeing the numbers go down, we still know that there are variants of concern out there, particularly the Delta variant, and that's why we're taking the steps that we are today, starting on Monday, to allow for those 7 public health unit regions that have significant volumes of the Delta variant to be able to offer a second doses, assuming people have had their first dose within a time period before the 9th of May.
Last question.
Your final question comes from Shalima Maharaj with Global News. Please go ahead.
Hi there. Thanks so much for taking my question. The first question that I had has to do with the level of demand that we're seeing from Canadians and certainly from Ontarians when it comes to vaccines. Why do you think that we are seeing so many people, going for those second doses and even those first doses? We are starting to surpass other regions in the world as well. Do you think it's anything to do with messaging? What is it in particular that has people approaching this with such a level of enthusiasm?
Yeah, it's a really good question. We've been, frankly, very pleasantly surprised at the amount of uptake and interest there is in receiving the vaccine. We saw, as we expanded through the age groups, there was always a concern about, are we going to see more hesitancy sooner on? And in fact, so far we haven't seen that. So it's a very positive sign that Ontario and Canadians in particular appreciate and understand the importance of protecting their friends, their family, their loved ones by receiving the vaccine. And I guess at the end of the day, I'd just like to say thank you, because the more people that choose to get a vaccine, the more we are protecting our communities. And, you know, we saw that when we focused in originally on our long-term care, on our health care. And then when we focused in on our hotspots that were really struggling with high numbers, like Toronto and Peel region. I'm just going to say on behalf of the Vaccine Task Force, thank you for doing your part, because it makes sure that all of us are safer.
Follow up, and this is the last question.
Thank you for that. And my next question has to do with, I'm not sure if you were able to see this as well, but looking at the Delta strain, according to the National Institute of Health, they had put out some data saying that 2 doses of Pfizer and 2 doses of AstraZeneca were shown to be effective against the Delta variant, but Pfizer to a much larger extent, 88% efficacy versus AstraZeneca at 60% efficacy. In your view, is that reason to be concerned that there is that sort of 30% difference between the two in terms of level of efficacy?
No, we know that if you receive double doses of any of the vaccines that have been approved in Canada and for use in Ontario, provides you with a significant degree of protection, and that will likely keep you out of hospital and certainly save your life. That is what this is all about, is saving people's lives, making sure that they can return to their families and their loved ones. And so all of the vaccines are very effective and will ultimately get you back into your normal life again. That's much better statistics than if you don't receive any vaccinations whatsoever. So we're very confident with all of the vaccines that have been approved.
Thanks, everyone.
Thank you.